Ladies and gentlemen, the topic of presentation is the smile aesthetics of evidence-based research and clinical application. I come from Taipei, Taiwan. Now I'm a Dean and a Professor of College of Oral Medicine, Taipei Medical University, Director of Orthodontic Department in Taipei Medical University Hospital. I was the immediate president of Taiwan Association of Orthodontists. I come from Taiwan. Where is Taiwan? Taiwan beside China and located in the East Asian area. My university is located the north of Taiwan, just beside the Taipei 101 Tower. My university are ranking about the 300 and 350 in the THE rank, and also the fourth of the private university ranking in Taiwan. My university established in 1960. This year is the 60 years anniversary. Okay, the first question: what is the most concern of the orthodontic patient in your offices? For my past research, aesthetics always the number one. I have another research. The motivation on the orthodontic treatment is the dental alignment and the facial appearance correction. And I instructed my foreign students and published the Journal of Dental Sciences. The motivation of the orthodontic treatment is improve poor appearance and smile, strengthening the teeth. Therefore, create the beautiful smile and create a beautiful aesthetic is always requested by orthodontic patient. Contemporary orthodontic requirement from the patient is to establish the facial balance and smile aesthetic. And another question: what is the facial aesthetic smile? From the definition of the dictionary, smile is a change of facial appearance. It is the secondary facial features after the eyes. And the smile aesthetic are multiple factors in nature, include the social, cultural, psychological, objective, subjective, and popular, etc. So from the ancient to the current days, there are different facial profile beauty. This is three famous star pictures. Which smile types do you like? Some gingival display on smile is aesthetically appealing because of the usefulness of incisor, but no standard answers. Therefore, do you think the smile aesthetic have standard criteria in orthodontic treatment? I will show you some case. Number one, this is gummy smiling with just the extraction 1, 4, 2, 4, 3, 4, and to put a test intrusion anterior. After the correction, the gum smiling corrected, and the patient satisfied the result. Second case, a gum smiling. In this case, belong to the skeletal type. We just prefer the level 1, 2 pieces, impaction and retraction, and mandible auto rotation. This is a good result, and the patient is satisfied. The number 3 is the open bite and the protrusion and the gum smiling. We just prefer the 4 bite extraction and the pull the head to close the bite. After the treatment, we get a good result. Okay, this is 3 before pictures and after pictures. Which type do you like? After the self-certification, they all satisfy the result, even the different the gummy smiling or the lip covering. From the literature, we can say just near the 70% like the average smile. For the maxillary anterior incisor curvature, the over 80% like the parallelism. And the number of tooth displayed in the smile just near 50%, right? To show the false premolar even the second premolar, and the position of incisor curve touching the lower lip near the 50%, like touch the lower lip. And this research from the Korea researchers, upper lip position near the 55%, like the average. For the period of anterior incisor curve with lower lip, 60%, like the parallel. In the relation between the upper anterior teeth and the lower lip, over 50%, like not touch. And the number of teeth displayed in the smile, 57%, like show the second premolar. Therefore, the different prevalence was shown in different people and the ratio. So how about the aesthetic smile prevalences in Taiwan? Do you need to reach the standard aesthetic smile for your orthodontic patients? Therefore, we prefer the research about the affecting factors of smiling aesthetic. We create a frontal 3/4 view and a lateral pictures. Frontal picture create the 8 variable, 3/4 view create 4 variable, lateral view create 7 variable. Each variable to establish 5 different photos according to the standard deviation by computer. So this 8 variable, later 7, 3/4, the different picture. And we hire the orthodontist, GP, dentist, layperson. The total is 773 to rent the best one with the Google form. Okay, we see the result. It's the 52%, like the parallel smile arc. But the 30% near the flat. It's the 40% like the smile, but the 20% like the flat. Therefore, not all the Taiwanese like the parallel smile arc. Only 30 to 40% like the flat smile arc. Therefore, very important. Not all the people like the standard smile arc appearance. Okay, the most posterior upper teeth visible, just the 30% of people like to show the second premolar, and in the 3/4 view, the over the 30% like show the second premolar. And the Taiwanese like the wider smiling tendency expose more back teeth because the short tooth is anterior than the Western research. Okay, for the upper teeth exposure, over the 60% like to exposure the gum, and the 40% is the same. Therefore, Taiwanese like the wide smiling tendency to expose more upper teeth and the gum, and the lower teeth exposed near 60% like to show the lower teeth when smiling, and the 40% in the 3/4 view also like to show the lower teeth. So in the Western research, just 70% like to show the teeth. Therefore, we can see Taiwanese like wide smiling tendency to expose more lower anterior teeth. Okay, for the buccal corridor, we just see the near the 50%, not only 5 corridor. So Taiwanese like the wide smiling tendency to expose more buccal corridor. In the Western research, just only 2% like this pattern. For the maxillary gingiva displayed, near the 70%, like to show to touch the gingiva and the tooth relationship. Therefore, Taiwanese have a tendency of accepting the gummy exposure. And from research, we also know the affecting factors of smiling include the gender, age, marriage, religion, education, occupation. So which one do you like from the cases? You see, the result is not the most people preference. They like their individual result. Therefore, in this research, we can see you need to incorporate the aesthetics minor factors to orthodontic diagnosis and the communication with patients, and to consider aesthetic smile is just a maximum consensus on smile preference rather than a smile standard. The affecting factors of smile aesthetics are multiple and subjective. The individual discrepancies cannot be reflected as long as the patient likes and is within the normal physiological forms and functions. It is the most beautiful smile. How about smile preferences in your country? Okay, another question. What is the correlation between the extraction or lung extraction and aesthetic smile in orthodontics? You see the case? These are three kinds of smiling. Which one is better? Okay, the case one is a crowding case. We just perform the 4-by extraction, relieve crowding, and step the good result. The second case is also to correction of crowding. We do the lung extraction, but create a good result. The number three, to complete the correction of the incompetence, we do the 4-by extraction, do the good result. Okay, so the three kinds of the smile result after the extraction or the extraction, which one is better? Now, therefore, the aesthetic smile after the extraction or lung extraction are some factors, include patient's concern, malocclusion type, orthodontist preference, and experience. Therefore, we just depend on the evidence-based medicine principle to do the research, follow the 5A of EBM. First, pick-up question. And the second, to acquire the exclusion criteria and the inclusion criteria from the 723 papers and fit the criteria. And finally, we find the 70 papers. The 7 papers. The results, non-significant difference from the subjective evaluation, non-significant difference objective. But the correct orthodontic diagnosis is very important. Therefore, we need the further analysis to verify the effect. Therefore, we do the meta-analysis to find the 5 papers. The result, no significant difference of buccal corridor between the extraction and the lung extraction cases. The result has been published in the Journal of Dental Sciences 2016. Therefore, the meta-analysis are limited. We also to make another research effect a smiling aesthetic between extraction and the lung extraction treatment in different malocclusion. We collect the data in my hospital, 90 cases, the class 1, 2, 3, depend on the different object. Each group have the extraction group and the non-extraction group. And we use the visual analog to select the best photos. And we have the subjective evaluation, frontal smiling photo 19, and have the layperson GP orthodontist to evaluate. The objective evaluation, we have the 9 variable smiling photos and the 15 variable in data itself. Look at the result. From the total, we can find the extraction aesthetic is better than the lung extraction. In the class 2 cases, the extraction result is better than lung extraction aesthetic. For the orthodontists, they think extraction aesthetic is better than the lung extraction. The GP dentist is also the same result. In the total sample, the smile variable is the dip height, arch height. In this class 1 sample, smile arc, benign arch form. The class 2, the no affecting factor. The class case, only arch form. Okay, we just see the different mark quotient. We have the affecting factor is dip height, arch form. And in the different extraction types and rated by multiple regression analysis, the old sample, the affecting factor is dip height, Barker corridor. Therefore, in this case, in general, small aesthetic extraction group is better than that of long extraction group. Small aesthetic of extraction group is better than that of long extraction group in 3 different mark quotient, but only class 3 mark quotient group have significant difference. In the 3 different rated group, they all think small aesthetic of extraction group is better than that of long extraction group, but only orthodontic group and the GB group have a significant difference. And the different variation of smile aesthetic between the extraction group and the non-extraction group is lip height, arch form, smile arc, benign, and the affecting factors of aesthetic smile is lip height, Barker corridor, tooth number. Therefore, the affecting factors of teeth extraction or aesthetic smile are multiple factors. We need to further research. The results have been published in the AJODO 2018. Okay, another question. What are the affecting factors of smile aesthetic on the different mark quotient? We see the case. This is a large overjet. We do the 1-4-2-4 extraction to establish the smiling and a good result. Large overjet, just decrease. Okay, another case, large reverse overjet scale class 3. Okay, we just do the orthodontic surgery. We prefer the 1-4-2-4 extraction. So large reverse overjet to get a good result. At least the class 2 dividing 2. 100% divide. We do the 1-4-2-4 extraction with tests and create a good result. Right? Okay, this open by case, we just do the long extraction to get a good result. Okay, so this is a horizontal large overjet and large reverse overjet, and the vertical problem, large 100% overbite, and the minus overbite, open bite. Okay, the horizontal dimension and the vertical dimension will affect the smile effect. We just don't know how did they affect the smile effect. Just we do the research and collect the data from my hospital. Just the 106 patients. We divide the horizontal object and vertical object group. And we analyze the 40 measurement from the samplometric data and the 8 measurement of smile aesthetic analysis. We do the pre-treatment and post-treatment comparison. Okay, now so the different mark quotient affect the factors. This is the significant difference between the 3 overjet group. You can see the more variable will affect the result. Therefore, different overjet discrepancy mark quotients may have different smile pattern. Okay, the significant difference between the group, the overbite, we see the only upper dip height have significance. Therefore, the smile divergence was less in vertical discrepancy of anterior teeth mark quotient than in horizontal discrepancy of anterior teeth mark quotient. Now we see the orthodontic treatment result in different mark quotient. Okay, this 3 overjet group. All the variable have the significant. It means the mechanism treatment, extraction or lung extraction, the surgery type, the clinical technology will affect the smiling result. And significantly, this is over by, it's only 3 variables was affected significantly. Therefore, smile change less in vertical discrepancy of anterior teeth occlusion than in horizontal discrepancy of anterior teeth occlusion between pre-treatment and post-treatment. Conclusion, most of the smile variables differ significantly among different object occlusion. Some of the smile characteristics were related to the sabermetric variable on different occlusion. Smile may be influenced by skeletal pattern, dental precumbency, or facial type. The smile divergence was less in vertical discrepancy of anterior teeth occlusion than in horizontal of anterior teeth occlusion. The smile change less in vertical discrepancy of anterior teeth occlusion than in horizontal discrepancy of anterior teeth occlusion between pre-treatment and post-treatment. The horizontal discrepancy of anterior teeth may be the major affecting variable to influence the smiling pattern of different occlusion. Therefore, in the orthodontic clinical application, establishment of optimal horizontal anterior teeth relation is the key to improve the smile characteristic in different occlusion. The result has been published in the KJO in 2007. Okay, now another question. Are there differences in smile variable in lateral and oblique smile photos among different occlusion? So we just to prefer the relation between the different occlusion and the lateral and oblique smiling view. Okay, we just collect the 390 patients. We divide the 3 groups, class 1, 2, 3, and we design the lateral aesthetic profile, 6 angular, 5 linear, and the 3/4 view, 2 angular, 4 linear, 1 number. We can see the comparison of sabermetric measurement between the different type of angle scarification. You see they are different. So the 3 groups have different pattern. And the comparison of lateral smile measurement between the 3 groups. All the measurements are significantly different. You see the oblique smile measurement. Most of the measurements are different among the 3 groups. Which I use the multiple linear regression. You can see the many variables are affecting factors in the different smiling view. Therefore, the smile pattern on lateral and oblique view photos could be significantly affected by different types of occlusion. Therefore, it would be suggested to include lateral and oblique smile view in data collection for orthodontic treatment planning. And the lateral and oblique smile character had significant correlation with some of the sabermetric measurements. The result had been published in the Journal of Dental Sciences, 2020. Okay, another important question. Are there differences in smile variable in lateral and oblique smile after photos after orthodontic treatment? For example, you can see the large object before the treatment, the frontal, oblique, and the lateral pictures. After the treatment, they can get a good result from the different smile picture. You can see we compare the red line show the significant difference from the 3 smiling view. Okay, this is a cross-bias correction, the 3 smiling view. After treatment, 3 smiling view, just no significant. We just collect the 21 case and 11 case to do the pilot study. The primary result is only the few significant from the lateral view. And this is class 1 and class 2 the difference. The red letters indicate the significance. Okay, because the sample is very few, now we have preferred the over 200 case analysis. Therefore, we will present the final data in future. Okay, so from the evidence-based in dentistry or medicine, the orthodontic will emphasize individualized and stratified. The result was requested or satisfied by patient themselves. It's very important. So how to make a smiling aesthetic important diagnosis and treatment planning. The Saber created a transverse vertical surgical term. The vertical is the lip height and transverse the arch form and the buccal corridor. When you expansion and widening the arch form, the buccal corridor became smaller, and the smile arc also became the fat. Also, with the palatal expansion, the buccal is small, and from the time maturation, the buccal corridor will increase. And the mandible asymmetry cases, the occlusion, the canting is very important. We need to adjust to frame the canter of mixed occlusion plane when to do the orthodontic treatment. Then we can create a good smiling picture. Okay, this is the case, the canting, narrow with expansion. Okay, canting after treatment, we can get a good smiling. Just this, the canting asymmetry after the surgery, we adjust the canter of occlusal plane, then we can get a good smiling planning. Okay, this is the sagittal the dimension when the maxillary deficiency after the advance, the buccal corridor decrease. So in this case, the protrusion and the gummy smiling after surgery, the maxillary setback and intrusion, the buccal corridor become larger. It's just the same, the intrusion, retraction, buccal corridor become smaller. Okay, in the posterior literature, the flared maxillary incisor tend to reduce the incisor spread, and uprighting the maxillary incisor tend to increase the incisor spread. In fact, from my research, just incorrect. The flared teeth tend to increase the incisor spread, and upright the maxillary incisor tend to decrease the incisor spread. They're the same. Okay, the results have published in the Chinese Dental Journal, and we also find the more inclination of upper incisor, the most flared or smiling arc. The less inclination of upper incisor, the more narrow of the smiling arc. Okay, this is a crowding and flared the occlusal plane, and after the uprighting, we can get a smiling arc. Okay, therefore, the timing dimension is very important. From the timing, we'll just increase the filter, decrease the incisor display. Okay, in this case, a long-term review from the 10 years, 11 years, 17 years, 19 years. From the 10 years, you long-term follow-up, you can see the rest of the filter increase. Incisor displayed and raised decrease. Incisor displayed during smile decrease. Gingiva displayed during smile decrease. Therefore, the principle of diagnosis and treatment planning, we need to put the smiling picture and idea in our treatment planning. Okay, the finally evidence base is very important for to do the orthodontic, and I emphasize the individualized and stratified. I have written the first Chinese edition, the evidence-based in dentistry, but in Chinese, not English. Finally, the offending factor on mistakes are multiple factors. The further research need to be preferred, but Correct diagnosis and full communication between the patient orthodontic are crucial and should be incorporated the orthodontic diagnosis and treatment planning. Aesthetic smile is just a maximum consensus of smile prevalence rather than the smile standards. As long as the patient likes and is within the normal physiological form and function, it's the most beautiful smile. The smile change lies in the vertical discrepancy. The horizontal discrepancy is to influence the smile pattern on different malocclusion. Smile pattern on lateral and oblique view photos could be significantly affected by different types of malocclusion. Therefore, it would be suggested to include lateral and oblique the smile view in data collection for the orthodontic treatment planning. Thank you for your attention.